Okay, hi everyone. This is Brother Wolf, and we're in HS 345, the finance class. And this week we're starting with the case studies. And I'd like to applaud our groups who were brave enough to go first. I know that can be sometimes risky, or not risky, but nerve-wracking, so we appreciate their willingness to be the first. Just a little background for the class. The idea here is, if we were face-to-face, we would all prepare for the case study and then come to class and we would discuss it amongst ourselves. So we're trying to mimic that. And the way we're doing that is two different groups are presenting the same case, and the reason we're doing that is so that you can see there may be slightly different variations or different approaches to these types of cases. So what we're going to do is each group will present. This is the first one. We'll post the recordings. Everyone should watch both recordings, and then on the discussion board, these groups will help kind of lead the discussion and maybe answer questions and maybe ask us questions and kind of prod us along just to make sure we're understanding kind of the process that they followed. And then everybody will, including those who are not in groups, will submit a written kind of analysis of this case, which is essentially you're doing the steps outlined in the book or in the case and answering those questions and kind of showing your work and that sort of thing. So that's kind of the idea here, and we'll do this a couple more times this semester. So I am going to turn the time over to the group, and I believe Pamela will start, so feel free to start when you're ready.
Great, thanks, Brother Wolf. Our case is number 6, the Columbia Memorial Hospital break-even analysis case. Just a little background, Columbia Memorial Hospital is an acute care hospital with 300 beds and 160 staff physicians, and it is one of 75 hospitals owned and operated by Health Services of America. Columbia Memorial Hospital operates an outpatient walk-in clinic that is located across the street from the area's major shopping mall and about 2 miles from the hospital. Patients who need immediate care for injuries or illness, be it a nail gun puncture or sore throat, are increasingly turning to walk-in clinics, or also known as urgent care centers. And these clinics aim to fill the gap between the growing shortage of primary care physicians and already crowded emergency departments. Walk-in clinics are staffed by physicians and usually offer little wait times, and they are a lot cheaper than the emergency department on copays and coinsurances, which is also dependent upon the procedure. They're also, because they are walk-in, there's no appointments needed, and they also have evening and weekend hours. They also offer many discounts to the uninsured and those with coverage and copayments. And let's see, about 8,000 of these clinics exist around the country, and 1,200 of them are affiliated with hospitals. This walk-in clinic that's associated with Columbia Memorial averages about 45 patients per day, and they have the capacity to see up to 85 a day. Right now there's been a decision trying to decide what they need to do with it. It is not producing as much revenue as the hospital would like to see, and so they are trying to decide whether they need to, 1, close the clinic, or 2, continue operating as is, or 3, continue with an expanded marketing program. This is question 1. I'm going to turn the time over to one of my group members.
So question number 1 asked us to construct a forecasted profit and loss statement for 2010 to determine if the clinic is projected to make a profit. And we used the total monthly average of all of 2009 and January and February 2010. And we based our projection off of 14,760 visits. So if the clinic continues to operate as they are right now with no changes, they will incur a loss of $105,276 for the year. So question number 2 asked us to consider the clinic situation without the new marketing program and to calculate how many additional visits must be generated to break even. So we use the total average monthly visits of 1,230 and the average monthly revenue of $47,037 in order to perform the break-even analysis. So the additional number of visits that we need to break even per month is 230. So that means that we need 80 additional visits to break even for a total of 49 visits per day. Question number 3 asks us to repeat the analysis for question 2, but this time we assume that the new marketing program is implemented. So in order to do this, we had to calculate the amount of revenue that is received per visit and the variable cost per visit, and then we were able to calculate the contribution margin, which is $34.74. We also have to calculate the additional fixed costs of implementing the marketing program and the semi-fixed costs for the physician's fees and the salaries and wages for the additional staff members. So if the clinic implements the marketing program with no additional visits per day, the total amount of fixed costs per day would be $233.33, which is the expense of the marketing program. So the number of additional visits needed per day to break even is 7. So we calculated the break-even analysis using the costs for an additional 1 to 10 visits by adding in the semi-fixed costs of the physician fees and the salaries of the additional workers, which gave us total fixed costs of $700. And we performed a break-even analysis and found that we would need 20 visits to break even. So we performed that same calculation for the cost of an additional 11 to 20 visits, factoring in the increase in the semi-fixed costs for the wages, and found that we need 21 visits to break even. And when we performed the break-even analysis using the total costs for an additional 21 to 30 visits, we found that we break even at 22 visits. So using the new marketing program, the clinic needs to bring in 22 additional visits. So they need a total of 71 visits per day in order to break even.
So I guess we want to go on to question number 7, which has to do with the distribution of the cost of the medical monthly medical malpractice insurance. So the Columbia Memorial Hospital has decided that they were going to allocate the $3,215 monthly cost between each of their divisions based upon number of visits. So without doing the calculations, your clinic will now be assessed a charge for their portion of the malpractice insurance based on the number of visits seen at the clinic. So if they see more patients and have more visits, then the cost, their portion of the cost of medical malpractice increases. If they see fewer patients, then their cost decreases. So in the end, it does have an effect on the break-even analysis because the hospital is charging them per visit for that overall cost. For question number 8, all of the calculations were done on a not-for-profit basis. If you were to all of a sudden become a for-profit organization, then you would be responsible for the taxes on your taxable income. Taxes overall reduce your net income. So the higher your tax rate, the greater your cost of taxes and the lower your net income becomes. And question number 9, I find this question pretty interesting. Does the clinic have any value to the hospital beyond the numerical analysis? So yes, I believe that the clinic does have a significant value to the hospital in that operating the clinic will decrease the amount of utilization of the ER. A visit to the clinic in the end costs less and allows for a potentially bigger profit. At the same time, it decreases the amount of visits in your ER, allowing for quicker treatment of level of care that is higher than what you would need at the clinic. In addition, under Obamacare, a lot of reimbursement is going to be tied to patient satisfaction. Patient satisfaction increases with a decrease in wait, faster care at lower costs. So it has the potential to improve reimbursement rate as well as allow for patients to be seen at a faster rate in each of their respective levels of care, whether it's at the ER or in the clinic. Part B of the question is about a competitor hospital that has bought a large physician practice. So in my mind, and that they are rumored to buy more physician practices, in my mind, this is something for Columbia Memorial to watch and be aware of. But I think that the problem or potential problem is multifaceted, being that it kind of depends where the other hospital is located at. If the other ER is within a close distance, then you may see and if the physicians now go and admit to and utilize the other hospital, you may see a pull from the use of the clinic towards the ER or a clinic of the competing hospital. However, if it is far away, it may not have much of a pull, being that if a larger hospital system comes in and buys a practice, but the doctors still stay with their local hospital, and then they just refer out to a hospital that's maybe an hour or so away for specialty treatments, for their cardiac caths, for their kidney issues, for things like that, so that they would refer to the larger hospital. But the urgent clinic in and of itself is not at too much of a risk, in that the patients are going to see their doctor in their office if they can't get in. If they can get in. If they can't get in, then they will go to a ER or an urgent care clinic, depending on the level of care that they need.
So question 10 asks us what our final recommendation is. If the clinic continues to operate as it is, it will lose money. So it's losing an average of $8,773 per month. If the clinic shuts down, they will incur a penalty of $37,500 for canceling their lease. So we believe that the clinic should implement the new marketing program to see if they are able to attract more patients and increase their revenue. And like some of the things that were mentioned in our answer to question 9, the clinic can be valuable for the hospital because it decreases the utilization of the hospital's ER, and the clinic can refer patients to the hospital for services. So we think that they should implement the changes and then reassess in a few months and then make the decision as to whether they should shut it down.
Great. Very good. So I'm going to hold off and not make a lot of comments here because I want it to kind of be part of the discussion board. Just anecdotally, it's interesting that you answered the way you did in number 9, question 9. That actually happened to me last fall, where I went to an urgent care clinic here in the Salt Lake Valley, and it was on a Saturday or Sunday. It was on a weekend, and they were kind of the only thing open other than an ER. So I went. They needed to do a special kind of ultrasound, and they couldn't do that at the urgent care center. So they referred me to the hospital emergency room, where I did go, and they were able to do those services. So I think you're right. I think there's legitimate. I don't know how you measure it. It's kind of hard, but maybe there's a way to measure the way that those kinds of clinics influence patients in the hospitals that they go to. So excellent. Very good. So if you would, as a group, you can either all do it or one of you, or however you want to work it out, but if you would post the slides and then kind of monitor the discussion board maybe 2 or 3 times a day, and answer questions and maybe ask questions if there's not a lot of questions being asked. It'll kind of help the discussion go along. And then I'll chime in with some questions too, so watch for my posts to kind of not necessarily poke at your assumptions, but just maybe ask for explanations and maybe offer other possible assumptions that could have been made and how it might lead to different calculations, so to speak. So. Does that sound good?
Yeah, sounds great.
Okay. Well, thank you very much. Nicely done, and we will discuss more in the discussion board. Thank you so much.
Great, thank you.
Bye.